faithfully conveying value and interpreting great books worldwide. Hello, this is Sally's Book Talk. Today I'll be interpreting a book called Contagion. The subtitle is Why Do Diseases, Financial Crises, and Social Behaviors Spread? When you hear the word contagion, what's the first thing that pops into your mind? And probably some major epidemics, right? Like the COVID-19 pandemic that swept the globe in 2020. But things that are contagious aren't just diseases. A massive financial crisis, some widely spread political rumors, or even a viral article that floods everyone's screens. They're all actually contagious. These contagion events may seem unrelated on the surface, but they hide some universal patterns underneath. If you pay a little attention, you might even find that the spread curves of financial bubbles and measles are almost identical. In studying spread patterns, epidemiologists are definitely the most authoritative group. The author of this book, Adam Kucharski, is one such epidemiologist. He's an associate professor at the London School of Hygiene and Tropical Medicine in the UK, focusing on using mathematical models to analyze infectious diseases. As a professional, Kucharski has been involved in research on outbreaks like Ebola in West Africa and Zika in South America. During the COVID-19 pandemic in 2020, he and his colleagues were among the most active research teams globally. He's published many papers on the novel coronavirus in top international medical journals. In this book, Contagion by Kucharski, it doesn't just cover the principles of epidemic spread. He uses real-world examples to show readers how contagion theory can be applied to specific social events. For instance, how methods for controlling AIDS can reduce financial crisis risks, or conversely, how increasing infection can boost online marketing effectiveness. So, this book blends theory and practicality, earning it a spot as one of the best science books of 2020 by media like the Times UK. I'll break down the interpretation into two parts. In the first part, I'll focus on explaining the theories behind contagion, after grasping the core concepts. In the second part, I'll use these theories to analyze social issues. All right, let's start by discussing the theory of contagion. For humans to understand contagion's essence, it takes 3 steps. Understand the mechanism, reduce the R value, and pinpoint the key. At first, it might sound confusing, but don't worry. I'll use a series of historical events and real data to explain clearly how contagion happens and how to control it. To make contagion clear, we need to start with a disease, and that's malaria. Malaria is one of the oldest infectious diseases known to humans. However, how malaria spreads has always been a mystery. For a long time, people thought contaminated water caused the illness. Others suspected that bad air spread the seeds of malaria. Because there was no way to find the disease's source, prevention methods were hit or miss, with poor results. It wasn't until the late 19th century that a British scholar named Ronald Ross revealed the mystery of how malaria spreads. Ross was a military doctor stationed in Bangalore, India. Near his residence, he always saw swarms of mosquitoes buzzing around water tanks. Ross speculated that this was where mosquitoes bred. So he dismantled those water tanks and, sure enough, got rid of the mosquitoes. This encounter with mosquitoes set the stage for the story that followed. Not long after, Ross returned to England on vacation and met a doctor named Manson. Dr. Manson discovered that when mosquitoes suck human blood, they also ingest various tiny parasites. Then, when those mosquitoes bite others, the parasites spread. Manson boldly proposed that malaria, which had plagued people for thousands of years, was likely related to mosquitoes. Inspired by Manson, Ross captured some small birds for experiments and found that through mosquito bites, malaria could indeed be transmitted from sick birds to healthy ones. And so later he found a type of plasmodium in the mosquito's salivary glands, which is the pathogen that causes malaria, thus proving that mosquitoes were the culprit in spreading it. It was the mosquitoes. And for this work, Ross won the 1902 Nobel Prize in Physiology or Medicine. After confirming the relationship between mosquitoes and malaria, Ross naturally proposed that the key to controlling malaria was to eliminate mosquitoes. That process did not call it magic, feeble, and fair. However, people at the time thought this idea was absurd. Obviously, we can't wipe out every single mosquito. As long as some survive, they can still spread the disease. But Ross disagreed. He believed that malaria could be controlled without eliminating all mosquitoes. So he specifically built a mathematical model for this. Just to add, although Ross was trained in medicine, he had a strong interest in math and was supposedly quite skilled. In this model, Ross first made some basic assumptions. Suppose in a village of 1,000 people, one person is infected with malaria. For malaria to spread, mosquitoes must bite this patient. Ross assumed that out of every 4 mosquitoes, one can successfully bite a person, meaning each person needs 4 mosquitoes. With 1,000 people in the village, it takes 4,000 mosquitoes to ensure one bites the infected patient. This is only the first step, where the mosquito acquires the pathogen, Plasmodium. The Plasmodium needs time to reproduce inside the mosquito before causing infection. So during this period, the mosquito must survive. Thus, Ross further assumed that out of every 3 mosquitoes, one survives long enough, so multiplying 4,000 by 3 gives 12,000 mosquitoes needed to reach the next stage of malaria transmission. Right. Step 2. Ensure at least one mosquito has enough Plasmodium to cause infection. Step 3. Have that Plasmodium-carrying mosquito bite another person. Based on the initial assumption, 1 in 4 mosquitoes can bite a person, so 12,000 multiplied by 4 equals 48,000 mosquitoes needed to infect a second person with malaria. This part is a bit tricky, but don't worry, we just need to remember one thing. Ross mathematically proved that eliminating all mosquitoes isn't necessary. Just reducing their numbers below a certain level can control malaria spread. Moreover, malaria isn't incurable. Many patients recover within a month. As new patients decrease and healthy people increase, the epidemic will gradually fade away on its own. With support from the mathematical model, Ross's earlier experiment of dismantling water tanks also proved that reducing mosquito numbers is feasible. Combining theory and practice gave Ross confidence. He successfully persuaded the Suez Canal Company to adopt mosquito control measures. The Suez Canal is in Ismailia, Egypt, where 2,000 people were infected with malaria annually. Measures included filling small puddles and clearing roadside water. These methods were used for large-scale mosquito elimination. Afterwards, the number of infections dropped to below 100.
Ross's research isn't just about killing mosquitoes. It has profound implications.
Back in Ross's era, most research on epidemics used descriptive methods. The core of this approach was to collect as much data as possible to assess the epidemic's spread. A classic example was William Farr's analysis of the smallpox epidemic in London during the 1830s. During this epidemic, Farr collected extensive case data and plotted detailed epidemic development curves. Though thorough, Farr's work didn't explain transmission patterns or predict future epidemic trends. His method helped doctors and policymakers understand the current situation, but did little for epidemic control. Unlike Farr, Ross proposed a mechanistic approach, building disease transmission models. In fighting malaria, Ross first identified key transmission factors. After understanding transmission routes and recovery times, he created a mathematical malaria model to predict outbreaks. The mechanistic approach included adjustable assumptions that could be fine-tuned for different regional conditions. And now, for example, increase assumed mosquito density in mosquito-heavy areas, or raise population density assumptions in urban clusters. Ultimately, this mechanistic weapon let people calculate the most effective measures and predict when epidemics would end. As scholars explored epidemic theory, research became increasingly mathematical. Amid complex models and theories, a simple concept called the reproduction number emerged as key to contagion theory. In 1975, German mathematician Klaus Dietz proposed the reproduction number R value, the average new infections caused by one infected person. If R equals 2, one patient infects 2 others, who then infect 4, and so on. Clearly, higher R values make outbreaks more likely, even causing pandemics. Lower values do the opposite. If the R value is less than 1, each infected person produces less than 1 new infection on average, so cases gradually decrease over time. Many factors affect the R value, with transmission methods being crucial. Respiratory diseases spread through sneeze droplets tend to have higher R values than blood-borne diseases. Factors like exposure numbers, susceptibility of contacts, and transmission success rates all influence the R value. So for any disease, the R value isn't fixed. The common flu has an R value between 1 and 2. Among vulnerable groups like the elderly and children, its R value may be higher. When people wear masks, wash hands frequently, and take precautions, the R value decreases. The 2020 novel coronavirus had widely fluctuating R values. Early in the pandemic, people were unprepared. Scholars estimated COVID's R value during this period was between 2 and 6. In extreme environments, like the Diamond Princess cruise ship with over 700 infections, the R value could reach 11. Even so, compared to measles, COVID seems less contagious. Among susceptible groups, measles' R value can reach 20 due to its exceptional resilience. Uh, uh, if an infected person sneezes indoors, the virus can linger for hours, potentially infecting everyone entering the room. After determining an infectious disease's R value, control methods essentially aim to reduce it, with vaccination being among the most effective. If vaccines give everyone antibodies, transmission can be fundamentally blocked. However, universal vaccination is clearly time-consuming and labor-intensive. Just as we can't eliminate every mosquito, vaccinating everyone is difficult. Based on the R value, we can calculate how many people need vaccination to control infection. For example, smallpox plagued humanity for at least 3,000 years, claiming hundreds of millions of lives in the 19th century alone. Among susceptible groups, smallpox had an R value up to 5, meaning one infected person could transmit it to 5 others. If vaccines were 100% effective, vaccinating over 80% of people could reduce the R value from 5 to below 1. Thus, over time, smallpox spread would gradually come under control. Thanks to vaccines, smallpox was largely eradicated in developed countries like Europe and America by the early 20th century. In 1958, led by the World Health Organization, countries joined forces to administer 500 million smallpox vaccinations across Asia, Africa, and Latin America, ultimately defeating smallpox. Beyond R-value pattern, disease spread often follows the Pareto principle. 20% of cases cause 80% of infections. During the 2003 SARS outbreak, 20% of cases caused nearly 90% of transmissions. These patients either had many contacts or wide activity ranges, creating ideal transmission opportunities for pathogens. The extreme case of the Pareto principle is the emergence of so-called superspreaders. This term is quite familiar to us now. A single superspreader might infect dozens, even hundreds of people. Early in the AIDS epidemic, there was one such notorious superspreader. In 1984, a Canadian flight attendant named Dayton Dugas died of AIDS shortly after his 31st birthday. In the year before, he'd had sexual relations with over 200 male partners. Many media outlets labeled Dugas as Patient Zero, the first case in an outbreak, with some speculating he brought HIV to America. However, recent research confirms this wasn't true. Dugas was merely an early case in the widespread epidemic. Both the 80-20 rule and superspreaders reveal an underlying pattern. Transmission networks have critical nodes. Controlling these key nodes could dramatically slow disease spread. Meanwhile, the author reminds us that even with perfect models and theories, disease control still faces many challenges. Despite our knowledge of viral biology and transmission methods, In the 20 minutes it takes to listen to this audio, about 20 people will die from malaria, over 25 from AIDS, and 4 or 5 children from measles worldwide. So epidemic prevention still has a long way to go. All right, that covers the topic of contagion theory. Let's pause here and summarize the key points of this section. Controlling an epidemic involves 3 main steps. First, understand the mechanism. Figure out the pathogen's characteristics, transmission methods, etc. Only after clarifying this information and building transmission models can we guide prevention measures. Second, reduce the R value. Whether understanding mechanisms or controlling key nodes, the ultimate goal is reducing the R value. Only then is the disease under control. Third, control key nodes. Manage that 20% from Pareto principle, especially preventing super spreaders. Similar patterns exist across many aspects of human society. In Part 2, we'll apply this knowledge to analyze social contagion across domains. First, let's discuss something close to home: how to create viral online hits. A viral hit could be a social media flooding article or overnight million-view video. They spread rapidly online like a massive epidemic, except the virus here is product information or article viewpoints. To create viral hits, we invert epidemic control, maximize information virus spread. First, apply step 1 of contagion theory. Understand the mechanism. What content has viral potential? Or rather, what information spreads like a virus? Actually, there's no definitive answer yet, but several studies offer clues. In 2011, University of Pennsylvania researchers analyzed 7,000 New York Times articles, finding emotion-provoking content got shared most. Strong emotions include both positive awe and negative anger. Both outperform lukewarm content in sharing. We can vaguely observe this pattern in real life too. Think about your social feed. Shared content usually makes people laugh hard or cry. Oh, there's definitely no shortage of things that make people furious enough to flip tables. Besides strong emotions, content needs mutation capability. Just like viruses constantly mutate to develop drug resistance, enhancing survival and infectivity, internet content works similarly. To go viral, it needs room for modification. For example, on video platforms, old clips often get remixed into meme compilations or funny edits, sparking new waves of views and shares. Similarly, classic memes constantly get updated with new content to match current emotions or trends. Whether sharp opinions or hilarious plots, viral content must offer sharing value and inspire remixing potential. With quality content, step 2 in reverse applying contagion theory is boosting R value. But this is tough. Online information spreads weakly. Take the viral ice bucket challenge years ago, designed to raise awareness for ALS, amyotrophic lateral sclerosis.
There's a ton and made describing mechanics. Participants film themselves dumping ice water, then nominated 2 or 3 others.
Nominees who refused had to donate to charity.
With Bill Gates and celebrities joining, it became a global sensation overnight.
Yet even then its R value is only about 2, typical for online phenomena. The most viral content has just 1/10 measles contagiousness. While high R content is hard, we can brute force scale, blast information to massive initial audiences. Let's revisit the contagion model. As discussed, R less than 1 means spread fades. To infect more people, introduce more transmission sources. Calculations show even a message with R equals 0.8 if seeded to 1,000 people initially, can ultimately reach 5,000. Compared to broad outreach, targeting key network nodes is more direct and effective. Information spread, these key nodes are called influencers, people who shape social trends. We can think of them as internet celebrities or super spreaders in information epidemics. The influencer concept originated from psychologist Stanley Milgram's experiment. In 1967, Milgram had 300 participants pass a message to a stockbroker near Boston. The broker received 64 messages eventually. Surprisingly, a quarter passed through one person. This person was a local clothing merchant. In the experiment, this merchant was the main node connecting the broker to the world. And clearly, such connection nodes exist everywhere, seemingly ordinary but crucial to information flow.
This inspired Milgram's famous 6 degrees of separation theory. Any two strangers connect through 6 intermediaries.
As communication networks advanced, this number shrank. Modern data-backed update, Facebook analyzed billions of connections and found just 4 intermediaries suffice today. Let's emphasize, even with viral content methods and influencer access, there's no guarantee content will spread. Expensive campaigns may reach few.
Remember, social networks' complexity creates countless random factors in transmission.
Financial networks are similarly complex, massive systems with unique features. Most notably, connections between banks aren't uniform. A few dominate the network. In 2006, researchers analyzing the Fedwire system found 75% of transactions occurred among just 66 institutions. So once this system gets sick, meaning a financial crisis occurs, superspreaders are highly likely to emerge during crisis propagation. In the 2008 U.S. subprime mortgage crisis, Lehman Brothers, a financial giant with over 1 million institutional connections, complexed with $600 plus billion in liabilities, directly dragging down Wall Street peers. Thus, controlling superspreaders is paramount to preventing financial crisis spread.
Perhaps epidemic control methods could apply to financial systems too.
For example, European agencies distribute free condoms or pre-exposure prophylaxis to sex workers to prevent potential HIV superspreaders. So,
Similarly, key banks should hold sufficient capital to reduce financial disease susceptibility.
we often hear too big to fail about large banks, but what truly matters is their network centrality. That's why they can't fail. Otherwise, the entire network faces collapse. Comparing crises to Contagion offers insights, but we must recognize crucial differences between them. During disease outbreaks, people evade infection by hand washing, masking, or social distancing, reducing exposure. In financial crises, banks hide by hoarding cash and reducing loans, limiting interactions. Yet the outcomes differ. Human evasion lowers R values and slows spread, while banks hiding accelerates crisis transmission. In 2008, U.S. banks freezing loans caused capital shortages, bankrupting SMEs, and accelerating systemic collapse. In finance, tiny variable changes can massively impact systemic risk assessments. Whether it's financial crises or the epidemic prevention and information spread we mentioned earlier, our research on these systems has only scratched the surface. Every advance in contagion theory overturns existing beliefs or ingrained views, and every new outbreak brings fresh challenges. As a famous saying in epidemiology goes, even if you've experienced one global pandemic, you've only understood that one global pandemic. Kids, old theories may not cope with new challenges. The most crucial moment isn't when we make the right decision, but when we realize our mistakes. All right, that concludes our interpretation of the book Contagion. Listening notes are below the audio. See you next time.